So at what point do you know what to do for that specific injury, whether it's like what are you looking for to say it needs surgery or let's just give it some time?
So the first two common presenting signs or symptoms that a patient will have when they have a hernia is one of two things typically: pain or a bulge or a mass in the abdominal wall, in the groin or the belly button area. And that can be a painless mass, or it can be all a combination of the pain and the mass together. Now that mass can be something else. It could be a lymph node, it can be a soft tissue mass. So what's really important is to get to a healthcare professional who deals with these issues to get properly worked up. And what they'll do is examine you, and typically any patient in my office, I'll examine them, feel the mass, see if there's a true hole in the abdominal wall, whether it's a soft tissue mass or a hernia. And if there's any question at that time, we'll obtain either an ultrasound, a CT scan, or an MRI to further work up and image that region to figure out exactly what's happening. Obviously, the most important thing is to figure out what you have first, then you proceed to treating it.
So is a hernia like a life-threatening thing? Like how, because I remember having a friend who said he had a hernia. I didn't know what it was, but he had this big bulge kind of in the lower abdomen area, and he had it for months. He never
Correct.
did anything about it. So what can happen if you don't really treat this thing?
So a hernia can be the simplest. A tiny little hernia is extremely non-life-threatening, it can be a very simple surgery, and they can also be the most complex surgeries we do, more complicated than any cancer procedure, depending on the size of the hernia, whether there's been previous surgery in that area, how many times the hernia's come back, and just the general size of the defect. A small hernia that's reducible, and what that means is you can push anything back into the hole. It is typically not life-threatening. There's nothing emergent about it. A hernia becomes life-threatening when the intestine goes into that hole and cannot be pushed back in. And at that point, it's called incarceration. And if it further gets stuck and cuts the blood supply off to the intestine, that's referred to as strangulation. And a strangulated hernia is a surgical emergency because typically within about 8 hours, the intestine can die. And if that happens, it can break open and it really causes a massive infection, sepsis, and can lead to very terrible complications.